Welcome to the UCL Centre for Anaesthesia podcast series. Things I'd wish I'd known before starting clinical medicine. This podcast is all about things I wish I'd known before starting clinics. I've just finished finals at UCL, and before I start work in August, I thought it might be useful to share some thoughts and bits of advice with other students who are about to start clinics. I'll talk about some ideas about how to survive from day to day, as well as preparing for OSCEs and written exams. I hope you find it useful. A lot of this is what I would have done in retrospect, rather than leaving everything to the last minute without really realising what was going on. Day-to-day stuff. Starting on clinics is very different from the first few years of university. You still have lectures, but much of the time is spent in clinics or on the wards. Some people find it useful to treat it like a job, even though you're not being paid. Try and turn up on time, but not hungover. One of the most important things to do is to get used to talking to and examining patients, and not just for the sake of getting loads of forms signed. These conversations don't have to be massive, even if it's just to ask people about how they are, or why they're in hospital, and you'll be surprised how much you learn and remember. As long as you introduce yourself politely and say something like, "Do you mind if I ask you some questions about why you're in hospital?" Or, "If you could start from the beginning." Most patients would be happy to talk to you. Then try and get a form signed for it. Although your timetable may seem daunting at first, there will be long gaps of free time, during which most people will go and drink coffee and read the Metro from cover to cover. You'll need to take breaks from time to time, but see if you can carry around some work with you expecting this, and you might get a lot more out of your day. Try to ask as many questions as possible, no matter how senior the doctor is. It can be intimidating sometimes, but remember you're still a student. Much better to get loads of mistakes out of the way before you start work. If you can't ask it immediately, write it down in a notepad and ask or look it up later. You'll spend a lot of time on ward rounds, which can be really boring, especially if you don't know what's going on. At the beginning, you might not understand what's going on, what the acronyms mean, or what the diseases are that they're talking about. As well as asking questions, carrying a copy of a small textbook handy, such as Cheese and Onion, which is the Oxford Handbook of Clinical Medicine, to look stuff up as you go along. And this will make everything seem less mysterious and make the time go faster. See if you can get something out of being on the ward every time you're there, learning something new, no matter how small it is, and keep positive about why it was you wanted to do medicine. From this, why not discuss interesting cases with your friends, not on Facebook obviously, and then clerk and examine these patients. OSCEs. Everyone gets terrified about OSCEs, but there's really no need. They're essentially a test of acting, to demonstrate how much time you spent on the wards, and whether you can behave professionally in such situations. One of the most important parts of the OSCE is also one of the simplest. Just be nice to people. Make sure you introduce yourself correctly, such as, "Hello, I'm a first year medical student. Would it be okay if I listen to your heart?" And make sure you thank them properly afterwards. Patients in the OSCEs will have been examined by loads of different medical students all day. Being polite will make you seem very slick. Of course, being polite isn't just about being slick. Patients in real life may be very anxious, and this will put them at ease. It should be the way you interact with other doctors, nurses and patients from now until you're a consultant. With regard to practical skills, I reckon the best way to do it is to practice it on the wards as soon as you've learnt it in clinical skills. It's not something I always did, but it works when you actually do it. You'll remember it in the exam and when you start work, whereas putting it off will make sure you forget it. If you fail a cannula, don't worry. Even the most experienced anaesthetists fail cannulas. Keep going and be confident. Written exams. Find a way of learning and revising that suits you. Writing notes, flashcards, mind maps. As long as it works, it doesn't matter. Mix it up so you can make revision interesting, even if what you're learning isn't. The stuff UCL will test you on will be from resources they've given you, not some obscure textbook. even if it seems they've tried to hide some of these resources online. So have a look around for stuff you may have missed. When it gets closer to exams, bear in mind that it's not a competition to see who can spend the most time in the library or to go without sleep for the longest. Keep playing sport, get some decent sleep, and remember that they're just exams. Time goes quickly, so enjoy it as much as you can, and make the most of every bit of holiday you get, including making sure you go somewhere amazing for your elective. I hope you found this useful. Enjoy your clinical years.